Let me ask you first, just to tell us how bad the RSV problem is right now. We're hearing some children's hospitals are filling up fast.
So thanks for having me on again. We have seen over the last several weeks that RSV has been affecting our children and our children's hospitals. And over the last several weeks, I believe that hopefully we hit our peak, particularly in the Hartford area. But throughout the state, we're seeing a little bit of a plateau when it comes to RSV cases. Our children's hospitals in the state are holding their breaths, but feeling like hopeful that maybe we are turning the curve. Having said that, we have to still keep in mind that our youngest children, particularly those younger than age 2, are those that are being most affected. And these are our pandemic babies that had the most amount of time at home away from others over these last couple of years. And so exposure to RSV can be very threatening to them in particular, and particularly if they need ICU care.
And we've been talking a lot about this triple-demic, right? So we have COVID, the flu, and now RSV. Is there anything we really can do to keep our littlest ones safe from catching RSV, the flu, and COVID, especially now that we're heading into Thanksgiving?
So, the good thing about 2 of these 3 viruses is that we have readily available vaccines. And this really is the #1 way to help protect your children. I know that people are tired of hearing about vaccines. They're tired of hearing about COVID and flu, which is starting to rise now in Connecticut as well. But these are tools that we have to either reduce the severity of illness or prevent infection altogether. And the interesting thing for our youngest children is that, if they were to suffer from long COVID or have difficulty smelling or tasting, these are things they can't communicate to us as well. And we have seen more instances of these types of complications in our youngest children. So although the incidence of death or really severe hospitalization is lower for those 2 viruses, they are vaccine reducible or preventable. Unfortunately for RSV, we don't have that. But what we can do is we do know that RSV tends to contaminate surfaces a lot. And for our youngest children, they tend to put things in their mouths, they touch each other. And so really good hand hygiene and trying to keep them away from kids who are sick. So if you have a sick child, please keep them at home, particularly our youngest children. Don't send them to daycare for the other children who are in that setting, because even if they don't have COVID, if they have RSV and another child gets it from other young children, it can be a serious virus for them to deal with.
All right. And really quickly, too, if children bring home RSV, can adults catch it?
So for adults, it is something that's possible, but most adults have gotten RSV earlier in their days. And as they get older, even if they get it again, it tends to maybe be a mild cold. Where that caveat on that is in our oldest age groups. I think people have seen through the COVID pandemic that our oldest age groups of people are those that are most vulnerable to basically every respiratory virus, unfortunately, that we have. But RSV can affect our oldest adults as well and cause more severe disease. So as we're going into these holidays, it's not too late to get vaccinated for particularly flu and COVID. We know that flu is rising. So although RSV may be starting to settle, flu is on the rise and will probably be in full force through Thanksgiving and probably into December as well. So take this opportunity to protect yourself and your family.
All right. Dr. Manisha Juthani, we thank you for joining us tonight.
Thanks for having me.